Hey guys, welcome back to my channel. This is Doc Janelle. The subject at hand is CPH, and the topic for this video is the Philippine laws related to public health. So please do stay and watch this video because this will be included in your preliminary examinations. If you're ready, then let's start. First, let us define some very important terms which we'll be encountering repeatedly in this discussion. First, you will see a lot of RAs in our discussion. RA stands for Republic Act. This is a legislation passed by the Congress of the Philippines and has been approved by the President of the Philippines. When we say Republic Act, this is a law that was proposed from the House of Representatives or from the group of congressmen and women. It went up to the Senate and was approved, and then later on was submitted to the President of the Philippines for approval. So if it comes from the Congress and has been approved by the Senate and the President, it is called a Republic Act. Next is a Senate bill. A Senate bill is a proposed legislation which must win majority approval in both the Senate and in the House of Representatives and then be approved by the President before becoming a law. So as we know, both the Congress and the Senate, they are both part of the legislative department of our government, meaning they are the ones who create laws and legislations. No? So when the law or when the proposal comes from the Senate, it is called a Senate bill. And even if it originates from the Senate, it must first be approved also by the group of congressmen and women or the House of Representatives. And afterwards, it will be submitted to the President before it becomes a Republic Act. Next, we have executive orders. An executive order is an order or a law that is given by the President in order to implement something that is a constitutional mandate or a statutory provision. This means that even the President has some legislatory powers, meaning he or she can create laws that should still be within the tenets of the Constitution. And lastly, we have the presidential decree. The presidential decree is actually similar to executive order, but the term presidential decree was more used during the martial law. Because remember, during the dictator, President Marcos Sr.'s time, he amassed all the powers. He was executive, he was legislative, and he was also judiciary. So lahat yon siya na. So they called the laws before as presidential decree. And later on, you will see some public health laws which were released as presidential decrees. So the very first law that we have to talk about is RA 1122-3 or the Universal Healthcare Act of 2019. This is very important because this will be included in your board exams. So you really have to be able to understand this. The longer name, so for all laws, they always have a shortcut name and they have a longer name. The long name of RA 1122-3 is an act instituting universal healthcare for all Filipinos, prescribing reforms in the healthcare system and appropriating funds therefore. So, what benefits did it give the Filipino people? First, it made sure that all people or all Filipinos are health literate. And this is part of the population coverage power of this law, which later on I will discuss, okay? Second, it provided access to quality health service, which is under the service coverage power of this law. And lastly, it protected people from the financial hardships associated with paying for healthcare. And this is part of the financial risk protection. So basically, the law is divided into three important tenets: population coverage, service coverage, and financial risk protection. So let's discuss those three important tenets. For population coverage, it means that every Filipino citizen shall automatically be included or enrolled in the National Health Insurance Program or PhilHealth. And I think even in the previous discussion, I was already able to introduce this tenet to you, that even you guys, even as students, even if you do not contribute directly, to the pool of funds of PhilHealth, you guys can actually, you guys are actually included in the beneficiaries of PhilHealth. Second, when we say service coverage, it means that every Filipino has already been granted immediate eligibility and access to all the health services that is available in the country, whether it be preventive, promotive, curative, rehabilitative, and palliative. And it covers all aspects or spectrum of health: medical, dental, mental, and even emergency health services. So basically, what service coverage tells us is that all Filipinos are they do have access, to all these types of healthcare services that are included, of course, in the Universal Healthcare Act. Second, that the DOH and the LGU shall provide every Filipino a primary care provider, okay, as their initial and continuing point of contact. This means that with the Universal Healthcare Act, every Filipino will have a family physician, a family doctor. Okay, every Filipino family will be assigned a family doctor. And if they get sick, if they have any problems with their health, they should first go, or their initial contact should first be their family doctor. They could not go to a specialist unless they are referred by their primary care provider. That is why when this law was submitted, or when this law was approved, a lot of doctors actually went into family medicine, because that is the thrust, or that is the direction where our healthcare is actually going. And then the last tenet is financial coverage, which I think is the most pressing for a lot of Filipinos. So there are two types of services under the Universal Healthcare Act. First is our population-based health services, and the second are individual-based health services. So population-based health services are financed by the national government. So it is the national government that pays and funds all these population-based health services. When we say population-based, these are health services that are available for all, meaning any age, any gender, any province shall be able to benefit from these services, and it is free of charge for all. Now, there are also individual-based health services which can be financed by our insurance, such as PhilHealth, such as our social health insurances, private health insurances such as MaxiCare, Medicare, Insular Life, mga ganyan, no? So, if the government does not offer it as part of population-based health service, then we may avail this health services via individual-based health services. So this means that a lot of medical services will now be given for free or for a lower fee. So if that is the case, then we need to be able to gather funds in order to, of course, sustain our services. So where will the funding come from? It will come from budgetary allocations from the national government. So as you know, every year they would release budgets, let's say for education, for health, etc. So that is where primarily the money will come from. Second, I'm very sorry about it. It should be sin tax, SIN. So the sin tax collections, which comes from your luxury items, cars, luxury bags, luxury brands, your alcohol, cigarettes, no? Yan, there are more taxes imposed upon those products. And every year, they would increase the taxes imposed upon those products in order to put the funding to UHC, or Universal Healthcare. 50% of PAGCOR income will also be provided for the UHC. PAGCOR stands for Philippine Amusement and Gaming Corporation. So yung mga loto, and even the other sweepstakes, ganyan. Diyan lang gagaling yun. And also 40% will come from charity funds, from the documentary stamp tax. So whenever you apply for any legal document, you always have to pay for documentary stamp. So that is where the money goes to the UHC, and also PCSO contributions. The next law, don't be confused with the RA. This is RA 1133-2. Kanina, RA 1122-3. Ito naman, RA 1133-2, or the Mandatory Reporting of Notifiable Diseases and Health Events of Public Health Concern Act. The longer name is this one. It actually is an improvement. Okay? RA 1133-2 is an improvement of an already existing act, which is RA 3573, also known as the Law on Reporting of Communicable Diseases. So basically, there is already an existing law, which is RA 3573, and it is known as the Law on Reporting of Communicable Diseases. But they found that the law already needed updates. It already needed some improvements and additions, of course. So they created a new law which updated the old law. So this new law is RA 1133-2. So basically, this law requires all individuals in all health facilities. When we say health facilities, hospitals, clinics, mga ganun, no, to report notifiable diseases both to the local and national health authorities. So why is there a need for a reporting of these diseases? So this law aims to protect people, of course, from emerging diseases, no, diseases which the general public may not be aware of. So there is a need for us to be able to notify the DOH and other health agencies about these emerging diseases. This is important in order for us to prevent the spread of these very harmful diseases and to be able to create strategies for its elimination and eradication. Also, this law aims to prevent any epidemics and the spread of other health events such as chemical, radionuclear, and environmental concerns. And also, it created an effective response system, which is embodied by an agency called PIDSR, or the Philippine Integrated Disease Surveillance and Response. Actually, this law was submitted and was passed before the pandemic, and so even with PIDSR being a young organization, it was really put into a test once the pandemic struck. The next law is the Generic Acts of 1988. So, or RA 6675. It promotes, requires, and ensures the production of adequate supply, distribution, and use and acceptance of drugs and medicines which should be identified by their generic names. So basically, this law promotes, encourages, and even requires the use of generic terminology in the prescription and dispensation of drugs. This means also that the government created this law in order to ensure that people would have access to the lowest possible cost of a certain drug, and make sure also that these medicines are free for indigent patients. So basically, doctors were required to use the generic name of a drug when we write our prescriptions, no? And it also made sure that drug manufacturers would be able to provide an alternative, a cheaper alternative to different medications. So let's define some important terms, no? Here on the right, you see a picture comparing your branded drugs versus your generic drugs. So as you can see here, in terms of active ingredient, there is no difference. What is active ingredient pa? It is the chemical component responsible for the therapeutic effect of the pharmaceutical product. So basically, it is the chemical that gives the effect. So dapat branded versus generic, it should be based on the same chemical that would provide the effect. In terms of pricing, of course, a generic drug would be cheaper. In terms of insurance coverage, generic drugs should always be provided for by the insurance. In terms of inactive ingredients, it does not have to be the same. Pwedeng magkaiba na yan. Um, in terms of strength and dosage, no difference. And appearance and look, pwedeng magkaiba na sila. So, the chemical name is based on the chemical structure of the drug. So, if you have organic chemistry, usually the organic chemical name of the drug is the chemical name. And when we say brand name, this is the proprietary name or the market name given by the manufacturer to distinguish its product from the competitor. So I'll give you an example. Um, Paracetamol, phenylephrine, propanolamine. These three medications, when put together, create a very important drug against influenza or flu. And there are different brand names available. You have your Neozep. Neozep is actually the same as your BioFlu. BioFlu is just the same as your Decolgen. Decolgen is just the same as your Simdex. So basically, different brand names, but they all contain the same active ingredient. And lastly, generic drugs are cheaper because they are not covered by patent protection, which are labeled solely by their international non-proprietary or generic name. What is a patent ba? A patent is a grant of protection for a certain invention. So let's say I was able to create a new medicine. I will be given patent for let's say 10 years, which means no other drug companies can make the same medicine that I created for 10 years. I will be the only one who can sell that medicine for 10 years. But after the patent has already expired, it is free for all, meaning other drug companies can start creating the same drug that I was able to create. Okay? But of course, I will always have that advantage because I am the one who is known in the market. I am the innovator drug. Ayan. Next is RA 7719. This is very important for you guys as medical technologists. Even when you go to third year, aaralin nyo to. So RA 7719 is the National Blood Services Act of 1994. It is an act promoting voluntary blood donation, adequate supply of safe blood, regulating blood banks, and providing penalties for violations thereof. So the main heart of this law is to promote voluntary blood donation. So before this law was passed in 1994, there was a rampant business in the black market where people would sell their blood for a fee. And people would sell their blood to hospitals, to patients, to relatives who would have patients needing blood. So it became very dangerous because a lot of people were dying because they were unknowingly selling their blood too rampantly, parang masyadong mabilis. So it laid down the legal principle for the provision of blood for transfusion, and that it made sure that blood donation was voluntary and was not a sale of commodity because our blood should not be for sale. So it made sure that the blood that we get in the hospitals are also safe, adequate, affordable, and equitable. So you won't be scared to actually be given blood in the hospital because you know that it was collected safely, it went through a process, there are no infectious disease found in these bloods, no? Also, it requires all blood banks to operate on a non-profit basis. Next is RA 8172, also known as an Act for Salt Iodization Nationwide, or simply the ASIN law. So, the purpose is to be able to eliminate a group of diseases called micronutrient malnutrition. And one example of micronutrient malnutrition is iodine deficiency. So they thought that salt iodization would be a cost-effective preventive measure for it. So they required all product manufacturers of food grade salt to iodize the salt that they would sell in the local market and even export to other countries. And also, it prevented non-iodized salt from being imported from other countries papasok ng Philippines. So, micronutrient malnutrition, why was there um, a big thrust to battle this? Macronutrient malnutrition is actually a group of disorders resulting from deficiencies in vitamin A, in iron, in iodine, and other micronutrients which the body would need, no, in minute quantities every day. So iodine is very important kasi in the production of thyroid hormones. So since we did not have iodine in our diet, a lot of people were developing iodine deficiency disorders. So this would lead to intellectual and physical problems. And so when they iodized our salt, it targeted people with goiter, mental retardation, physical and mental defects, and even cretinism. So guys, you have to understand that iodine is not produced by the body. So we cannot get it elsewhere except from our diet. Okay, so this law had to be created to ensure that people would get their iodine from a food source. And salt iodization became the solution to that. So the BFAD, or Bureau of Food and Administration, which is now known as the Food and Drug Administration, was the one who decided as to the form, the fortificant, the method, the manner, the composition of iodine that has to be added into our salt. Next is RA 8423, or TAMAC. What is TAMAC? The Traditional and Alternative Medicine Act. So, first we have to be able to know its purpose. So, it promotes and advocates the use of traditional and alternative medicine for preventive and curative modalities as long as they are proven safe, effective, and cost effective as well. So let us define first these two important terms. What is traditional medicine versus alternative medicine? So when we say traditional medicine, these are a sum of knowledge, skills, and practice on healthcare, which may not necessarily be accepted in modern or in the scientific framework, but it has been recognized by the people to improve their health. And nowadays, there are now newer studies supporting the benefit of this traditional medicine. So, what is under traditional medicine are the use of herbal medications, the use of non-chemical um, medications as well. When we say alternative medicine, these are non-indigenous. When we say non-indigenous, it did not come from the Philippines, okay? It is not a local practice, but instead it is an imported healing method, or it came from another country, which may have been practiced for centuries already, or may have been just handed down from one generation to another. And this includes reflexology, massages, acupressure, acupuncture, your chiropractics, and nutritional therapy. So these are not necessarily traditional, but these practices also did not originate in the Philippines, but they are considered traditional medicine in other countries. Yeah. Next is RA 8749, or the Clean Air Act. So it is an act providing for a comprehensive air pollution control policy and for other purposes. So it recognizes the Filipinos' right to breathe clean air and to use our natural resources for sustainable development. So basically, this act laid out programs for air quality monitoring. So we actually have this, and yearly they would report on the quality of air in the Philippines. It also laid out programs such as emission testing, di ba? For cars, may emission testing. Also, the use of biofuels such as our diesel, our gas, and it provided sanctions for companies or individuals who may contribute to air pollution. Another legislation about our environment is RA 9003, or the Ecological Solid Waste Management Act of 2000. So it ensures the protection of the public health and environment by utilizing environmentally sound methods for the utilization of energy and resources. So ano ba yung methods na yan? So it ensures proper segregation, collection, transport, storage, treatment, and disposal of solid wastes. So here are the different methods that this law actually supports. It supports composting, recycling, reuse, recovery, and other newer methods such as the green charcoal process and even treatment and disposal of solid wastes. So let's define some of these newer methods. When we say composting, we will create an organic matter by adding microorganisms to our waste. So we add bacteria and fungi to our solid waste, and eventually it will rot, it will decompose, and it will create a humus-like product, which may be used for fertilization. Yeah. Next is recycling. When we say recycling, we use chemical materials, no? So you treat this solid waste with chemicals in order to create something beneficial out of the solid waste. So when you say recycling, you add already treatment or you add already chemicals to the solid waste para magamit mo siya ulit or so that you can use it again. When we say reuse, you will not use physical nor chemical components. You will just simply use it for another purpose. No, but there are no physical or chemical changes done on the solid waste. When we say recovery, we divert the products from solid waste. So the recovery is the process of getting these products for possible recycling. And segregation refers to the practice of separating different materials, no? So we separate nabubulok or ang tawag dito. I forgot what they call that. Yung mga nabubulok versus hindi nabubulok. Ayan, di ba? So here is a graph showing you how long it would take for solid waste to actually be decomposed. And look at your styrofoam. Over 500 years before it actually decomposes completely. Your plastic would need 500 years as well. So actually your styro, your plastic, aluminum cans, these are really where the effort should really be given. No? Yeah. Next is RA 9288 or the Newborn Screening Act of 2004. So it aims to establish and integrate a sustainable newborn screening system within the public health delivery system. So basically, it wants to make sure that all the babies born are healthy and that the testing for it is already included in our healthcare system. So what they did, they created the newborn screening, which is the process of collecting a few drops of blood from the heel of a newborn and putting it or blotting it on a piece of paper, which we put in a machine, and the machine is the one who tests it and determines if the newborn has a inheritable condition or namamanang sakit. Okay, something that you inherit from your parents. So here are the different diseases which are included in the newborn screening. So congenital hypothyroidism, congenital adrenal hyperplasia, phenylketonuria, galactosemia, what we call as G6PD or glucose 6-phosphate dehydrogenase deficiency, and MSUD or maple syrup urine disease. And look, if a baby has any of these 6 diseases, and it will not be screened by newborn screening, what will happen? They will get mental retardation or even death, cataract, anemia, kernicterus. No? So those are the um, different complications of these diseases. But if we are able to detect them when they are newborns, we can actually start treatment and look what will happen. For mental retardation, they can actually live with normal mental health. They can actually survive death, the death sentence, di ba? So, ayan. So, ang laking benefit. Next is your RA 9482 or the Rabies Law of 2007. It provides the control and elimination of human and animal rabies, and it provided penalties if ever you will not follow the rabies law. So basically, this law provided a system so that we can control and prevent the spread of not only animal rabies but even of human rabies. So why is rabies important? Because it is a fatal disease. Fatal meaning it can lead to death. The group of virus that provides rabies is called Lyssa virus, and it is transmitted mainly through the bite of an infected animal. So the picture on your right, this is how the Lyssa virus would actually look like. Para silang bullets, di ba? A bullet-shaped virus. Yeah. So what did this law do? It provided programs such as mass vaccination of dogs. It also created a database so that we know if a certain dog has been registered and vaccinated. We also created a place for all unregistered, stray, and unvaccinated dogs. So now, di ba yung mga those dogs that you see on the streets which are um, probably abandoned, ganyan, the government has a program for them. And also, it conducted education campaign for the prevention and control of rabies. Next is RA 154. This is the Motorcycle Helmet Act, which aims to be able to provide our Filipino citizens who would use motorcycles and the motorcycle business such as angkas, joyride, ayan, and be able to protect them from extremely injurious effects of accidents and crashes. So basically what this did, it required all drivers and passengers of motorcycles to actually have a helmet, and this helmet should be approved or should pass the Philippine standard and should have a sticker from the import commodity clearance of the Bureau of Product Standards. Okay? So nowadays you cannot buy a motorcycle without a helmet. So basically they put it in as like an incentive or a freebie. Diba? Next is RA 10354, which is a very, very controversial law of the RH law, which was approved in 2012. So if you remember, probably you were kids back then. If you would remember, this was very controversial because it was really a battle between the church and the state. Um, but the good thing about it is that the state really, also um, considered the apprehensions of the church. So this law enabled people, especially couples, to have a say on the size of the family that they want. So if they only want 3 kids, then there are options in order for them to ensure that they will only have 3 kids. No, so it provided resources that are affordable and that are moral and religious as well. So it's still, we do not allow abortifacient use, meaning we cannot abort babies, but the RH law provided other medically safe, medically legal, and accessible ways to ensure our population. Next is RA 10643 or the Graphic Health Warning Law. So it obliged cigarette companies to put pictures of possible side effects of cigarette smoke. Okay, so as you can see in this image, no, may mga pictures of different diseases. So the aim really of the graphic health warning law is not to put these cigarette companies into bankruptcy, but really to help the youth. So that was the real purpose of this law, no, to curb and discourage the youth from the use of cigarette smoking. So we used graphic health warnings, which are photographic images printed on tobacco products, and also with accompanying textual warnings. So if they do not know what disease is in the picture, they can definitely read it in the textual warning. Moreover, the law prevented the use of misleading or deceptive descriptors such as low tar, light, ultralights, or mild, because it conveys a misconstrued message that cigarettes, these types of cigarettes, are healthier, less harmful, or even safer. Next is a very important law for medical technologists, which is RA 10871, or the CPR Act. And when it was still in the Senate, it was called the Samboy Lim Bill. So the longer name for this is Basic Life Support Training in Schools Act. It started as House Bill 6204, or the CPR Act, also known as Samboy Lim Bill. Sino ba si Samboy Lim? Samboy Lim was actually a basketball player who suffered comatose after experiencing heart attack during an exhibition game. So, the comatose could have been prevented if someone knew how to perform CPR during that exhibition game. Unfortunately, no one knew how to do it, and so no one was able to help him. He was brought to the hospital. He actually survived, and currently he is bedridden. Okay? So they named this law after him. So as you can see in this picture, it provided students as young as elementary students and as old as college students, no, to know how to provide CPR to their friends. We're nearing the end of the presentation. We have here a presidential decree, PD 856, Code on Sanitation of the Philippines. This is the effort of President Marcos to make sure the cleanliness of our nation. Not only was it about cleanliness, but also about sanitation of different services and even of our food. No? So, ayan. So this is applicable for you guys because RMTs, medical technologists, are the ones who perform water analysis to ensure the safety of our drinking water. Lastly, we have EO 51 or Executive Order 51, also known as the Milk Code. So this aims to contribute to the provision of safe and adequate nutrition for infants by promoting breastfeeding, and if the mother could not really provide breast milk, to ensure that there are breast milk substitutes that are healthy. So the goal of Milk Code is to be able to provide colostrum. What is colostrum? It is the first milk from the breast of the mothers, which contains your antibodies and immune cells to help build the immunity of the infant. So if the baby is able to get the mommy's colostrum, it will provide a tough coating on their stomach to prevent diseases from happening and to help prevent low blood sugar in babies. So because of that, in every mall and institution, there are now what we call breastfeeding stations. Okay, in schools, in the mall, in workplaces, and even in the airports. So that's the end of the discussion. Hopefully you learned something. Good luck and God bless on your prelims.